How do you determine what areas or what physicians you're going to start with? I know that a lot of times there's champions within the organization that you just naturally go to who are willing to try things out. Is that how you do things at Metro Health as well?
Well, we did it a little differently because, let's be honest, this technology for our size can add up as far as the cost. It can be expensive. And so with our pilot program, what we did is we used the data that we typically connect or are collecting on our providers within our EMR. And so we look at things like time and notes per day, time and notes per appointment, how long is the documentation, what is their workload over how many patients they see, and their efficiency with Epic. What we call pajama time, so anytime they're documenting outside of typical work hours. Then we look at work that they're doing on their scheduled days off and work that they're doing on days that they have no patients scheduled. So we look at all of those. And then I wanted to look at, okay, who are our providers that are really struggling, and give them DAX to see if we can help them. And I really wanted to see what our really efficient providers are doing and how they feel it interacts with their workflows. We at Metro, we are not touting that this is a time saver. This is efficiency. Our providers who tend to be a little on the slower side with their documentation, we've decreased one of our providers 5 minutes per note in documentation. So in this provider's particular case, it was a time saver for them. The provider that is, the couple of providers, one in particular who is very efficient, he spends about 2 minutes per patient per note, which is actually pretty good as far as the national average is concerned. And he said to me that this technology, DAX, doesn't necessarily make me faster, but I will tell you it makes me much better. It works on both ends of the spectrum. And then we have providers who are in the middle. We have providers who were hesitant to use the technology, and I wanted to get their input on them. We have providers that are kind of in the middle that were just kind of ambivalent about using the technology. So we kind of chose our providers based on, can we really, what are the use cases? What would the adoption be? We kind of wanted to use both primary care and some specialty. We attempted to use an entire department. We wanted to see how it would work just with an individual provider just using it. We wanted to see what an entire care team would do, and then we wanted to see what an entire department would do. So we kind of chose our providers based on what we were looking for as far as the end game, which is really an institutional rollout of this technology. So it is available to anyone, like I said, for anyone at the time they think it is going to make them the best provider.